Good afternoon, everybody. Today, I am delighted to be interviewing Linda Schmac, who is the president of Premier Comp Solutions. It is really an honor to have you here. This is VISTV, a place where I sit down with leaders in the workers' comp industry to discuss anything from leadership to technology to motivating our teams and to growing not only our companies, but services within the industry. So welcome.
Welcome. Thank you for having me.
Pleasure, pleasure. So talk to me a little bit about you yourself and your management style, how you motivate your team, but also being the president is one aspect of running a company. You also manage managers. And that in and of itself is another diversion of where you put your skills and your time into the company as president. Talk to me a little bit about managing a team, not just a company.
Okay. Most of our managers have been with us for at least 10 years, some up to 15 years. And I'm a big proponent of promoting from within. I mean, we are a niche industry. I mean, we're a niche company in a niche industry. So we have a leadership program and we really try to, we mentor those people. I mold them into what we want them to be honest with you. But we work by example. I work when I'm training somebody, I'm just very closely with them and I show them every aspect of the job. And they have grown from within. You have your diamonds in the rough and you can see them pretty quick and you invest time in those people. And that's what we've done. And that's why we have such a core group in every single department. We have core managers. And that's really the most important. Not that your whole staff is not important, but if you have a core, and let's say something happened and you lost all of the other people, you can still stay afloat and build from that.
That's so very true. I dare say though too, Linda, knowing you, I don't know you well. We're in the process of learning much more about each other, which has been fun and something that I look forward to in the future. But you also, in working your way up until this position of president, have had many roles that you have sat in. But many of them in the workers' comp industry, you've actually done the task. So do you find that easier when you manage a team, that having that experience in the industry helps you?
I believe it's critical. I do. There's not one job in this company I haven't done at some time. I've been in this industry for 30 years. So I have done data entry to reprice bills, done medical bill review, I've managed injuries, I have scheduled appointments for patients, I have created provider panels. So there's nothing, and actually, even when we landed a big account, when you said what motivates my people, we might need like 20 people because we landed a huge account. This actually happened a couple of years ago. And we said to the client, we need a couple months to start. And he said, we'll give you 2 weeks. We really needed 20 people. Okay. So a lot of my staff were working overtime, but I'm there with them. I'm working late with them. I'm reviewing bills. I'm entering. I want them to know, they know when you say motivate them, I'm right there with them. So I make sure my freezer is stocked with food so they don't go hungry. I'm delivering, whatever to make them happy, to make them more comfortable. But until everybody is hired and trained to implement this new account, they know I'm going to roll up my sleeves. I'm going to be right there with them. They know I can do all of their jobs. I think that's comforting to them.
I do too. I actually interviewed my own VP of operations a couple months ago. I had done many interviews prior to that and then thought, let me go face to face with the person who runs Viscardi. And that very much is, you mirrored exactly what she said. She talked a lot about rolling up her sleeves, getting on the ground, working every step of the way and understanding it. We built, you and I have talked about this, we built our own system to maintain data, analyze data. I know you have done that too. And I think when you have that ability and capability, it allows you to really analyze things that your company is doing, things where you need to change, move forward, maybe take a step back. And she spoke a lot about that. A lot of the leaders that I have talked to very much have started not necessarily at the top, but parallel to a lot of the positions of the people that work under them. And that really allows for an understanding of what it is like within the team and how people work together. But tell me about that stocked refrigerator.
Well,
tell me about your motivational techniques with your team.
You know, it's different for our employees. Like I have 4 floors and I keep all of the freezers. This actually started with that count. I, put breakfast and all sorts of lunch, frozen foods, with this, Boston markets, everything, Schwann's ice cream. There's always also, it's a huge, big freezer, but I have them on 4 floors. And it was like, oh, if you forget your lunch. Now it's like, it's there every day where we're filling it, and I have my, but we also deliver, they really like them. I think they like it better than we have a good profit sharing plan. We laugh about this, but I can send out an email saying, oh, great, we're going to contribute X to your profit sharing, and I'll get a couple of thank yous. But when you have the breakfast delivered or the lunch delivered, my inbox is filled with hundreds of thank you. Oh my God, I'm so good. Did you see that our health insurance premiums went up, and we're going to bear the cost of the increase. And I'll think, oh, they're really going to love that. Well, I found out the food is the key to people's hearts. I mean that. Not that the other things aren't important, but I'm telling you, they recognize that more.
It's the little things where you stop and take a moment to really know the people you're working with and care about them. We had a March Madness in-house tournament. So the top 3 people didn't realize it, but we're working remotely. The top 3 who came in, I guess you call it the brackets. They chose the right brackets. They all got basketballs delivered to their home. And I never received more thanks than when we do something else that I think is more meaningful. But I think it's the little things that make people realize how much you care about.
Yeah, whether it's like Pittsburgh Penguin tickets or Steeler tickets, or what people like the most, you can motivate them. Gift cards, I raffle them off all the time, gas cards and Starbucks cards, and just do little things. And believe it or not, they really like that. That's what I see motivates them more than the profit sharing or the help.
Are you working remotely? Has the pandemic changed the way your operations?
It did initially. So about 70% of the people were working remotely, and I don't know if this happened to you, but in our state, for about a 48-hour period, we were considered non-essential. They had not designated insurance-related activity companies as essential. Well, how do you, with 4 hours, shut down your whole operation and be remote? You need transition time. That's when you say, we get all our managers together, literally went out and bought 80 laptops. Within those hours, we had everybody going to every store and buying all of them. Thank God the governor deemed us essential, but still, that would enable us to transition 70% of our workforce remote. While we're completely paperless, some of our clients are, so we were still getting boxes of bills, paper bills, that although we're paperless, needed scanned into our system. So we did need people here. I and my management team came in the office every day. I did not feel it was fair to have 30% of our people working here if we were not willing to all come in. So it didn't change for me. I was always here.
Right.
So
how did it impact? I know you have diagnostic networks, you manage PPOs, panels, MD panels, PT scheduling, OT scheduling. How did the COVID pandemic impact that initially?
Well, it impacted it, not that we couldn't get in touch with the claimants to schedule their appointments, but you had some scheduled doctor's appointments as well. You had some doctor's offices that would not see people in person. And then you had PTs that were only offering telephysical therapy. And some of the diagnostics were not considered essential. Mm-hmm. So it was quite a challenge. And you have, as much as we may all be tech savvy now, your average claimant may not be.
Right.
So that was quite the challenge, that you had to get them set up for telehealth appointments. And then we also had to get approval from all of our clients to do tele-PT. Had to contact every one of our network providers. Number one, to see if they offered it. Number two, to negotiate reimbursements. And then also contact our clients, because that was not an approved expense. I mean, the workers' comp departments in the various states did not approve tele-PT as approved during the COVID crisis. Right. So we got their approvals. That was quite the challenge, because like we're doing this Zoom meeting today, some people are not computer savvy and they did not even know how to get
tremendously. So it is definitely, I feel it has changed the industry. I think in a lot of ways, it will be a benefit to the industry. Do you still see a large percentage of telemedicine visits?
We still see some, but not nearly as much. I think for the most part, people want to see, especially for work injuries, they want to see a doctor. And our clients want them to actually go in person to be evaluated, especially if they're off work.
Exactly. You want that objective measurement to really assess whether or not someone is capable of returning to work, even if it's modified duty. But I do think we primarily specialize in New York. The Workers' Comp Board in New York has continued their emergency adoption of telemedicine probably into the late summer, and it may continue after that. I think it has become very helpful to many people to have that telemedicine visit. I don't know how it expedites return to work. We're doing studies on that now. So we'll see when we analyze the data, how much that has really impacted people's lost time. Right. You talked about states. How many jurisdictions would you say you're involved in with your services?
We can do repricing in 50 states nationally. And I would say our PT and MRI networks are 43 states. Some of the other states, no one else has networks in them because they're not. It's like Alaska, there's one MRI here. But yes, we're pretty much.
That is impressive. That is impressive. That's very impressive.
So it started 19 years ago, Pennsylvania only. And then I had clients that said, will you move into New Jersey? Will you go to, let's say Walmart's one of our biggest clients. So they wanted us in Pennsylvania, then they wanted us in Virginia, then they wanted us in Georgia. And we just expanded with our existing clientele. So we went from regional to, well, we've tried East Coast until they set up Georgia. And then we decided to go national.
That's great. That's great. And there's positive feedback in the realm of your diagnostic testing and PT. So kudos to you and the work that you have definitely put into it. That is for sure.
That's one of the things you said, like when people call Premier Comp, they don't get an answering machine. They don't get that, you have reached, they don't get you have reached Premier Comp, please wait on the line. Your call is important to us. Well, I always say when I get those calls, if my call was important to you, you pick up the phone and you talk to me. So we three-way the patient on with the provider and we get those appointments. And we never outsource. Everything's here based in our corporate office. We don't outsource any of our services. I think that makes a difference.
Oh, tremendous. And I think to your point of three-way calling, that really expedites services. I don't think there are a lot of companies out there currently doing that. So that's really.
We do it because otherwise you're calling back the patient and the provider back and forth to say, is this time okay? No, it's not. Back and forth. This way you get all the parties on the phone, you get a consensus on the time, and you get the appointment scheduled right then and there. So
that's great. That's really great.
And well, Joan, to your point, when you've done the job before and you design, you're not purchasing cookie cutter software, you're designing it because you know the best way to operationally run each department. I think that makes a big difference when you.
Oh, I think tremendously. I know this. The software that we've developed and the tools that we've developed to really provide premier case management services compared to no others. And I've, myself, you and I have talked about it. I've been in the industry over 30 years. I won't say more than that because that's really starting to age me. But
I've been 32, so I'm aged. I'm there right with you.
But I know from experience what is not available. And when you know that it's not what is available, you want to know what's not available. It's like asking the question, how do I know what question to ask if I don't know what I'm looking for? But when you have worked all those positions and when you have started, I started as an intensive care nurse, managing an intensive care unit at a really young age. And it was really like being thrown into the fire. Well, here you are. How will you get the work done? How will you keep people, at the best health that they could be and have a team of nurses to work with that you can bring to a higher level? And it's really just discovering, creating, and moving forward with really implementing changes that you feel are necessary. So I know with Premier, it is a great thing to really understand that you're dealing with people. You're not dealing with people who are putting you on hold. You're dealing with a team of people who really have one goal in mind, and that's to expedite care, to do it appropriately.
Well, your background, you have empathy for the injured worker as well. That is
very true.
Yeah, I think that is critical. Not all case management companies, I know them. I mean, their insurance background and they're more company oriented. They've never been in the claimant's shoes or have seen them suffer with illnesses and sometimes don't realize they really do want to get better. They don't want to be in pain.
That's very true. Very true. And I thank you for that. Yeah. Part of our value and mission statement is compassion. True. To really have compassion, just like I'm looking at the comment behind you, always be humble and kind.
Oh, that's my motto.
Everyone
has a story that will break your heart. Every time I meet somebody, I heard that one time. And then when I look at them, I'm thinking everyone has a story that will break your heart. And that's true. I don't know one person that doesn't have something that would break your heart. You may not know what it is, but if you got to know them, you'll find out. So you treat everybody the same way you would want to be treated.
Exactly. Well, what do you see for the future of Premier? Do you meet as a group and creatively brainstorm for new services, new ways to provide what you're providing better?
I am a big believer of focusing on your core services. I think some companies make a mistake and they diversify too much. We focus on panels, injury care, and, coordination, medical bill review and repricing, and we have our own PT and MRI network. 5 things that we focus on. We've had people come to us and say, you want to get into transportation, you want to do IMEs, you want to do peer reviews. No, I don't. Because I don't want to be a jack of all trades and master of none. I want to be a master of 5 services and just expand upon them. For example, right now, like you said, what is our future? We have invested a lot in technology. We now have a client web portal, web applications, a client portal, where our clients can receive updates in real time. Their diagnostic reports, their PT notes, the work status report forms from the various physicians in real time. They can have them come right to their inbox, or they can sign into our portal. They can set it up any way. They can see their panels. They can see all of their bills and their EORs. And so we really, our goal was, what can we do to help you make your job easier? And that, when you said, what do? We focused our efforts on that versus getting into a dental network or something that I didn't think would be as helpful. So we just keep advancing. We talk to our clients and they'll tell us, we want to have reports. Walmart's big on that. They want a lot of data. And we sit down and we strategize how to create reports for them to help them do their job So that's really where it is right now.
That's great, because we're living in a world right now that AI, artificial intelligence, is taking over so many aspects of claims management. And I think if we can find that sweet spot between AI and being humble and kind and compassionate,
right,
and providing services that, like you said, you reevaluate, you're not into everything. So you have the time to reevaluate, work with clients to be really specific as to what can make it better. I think that's really the formula for success.
Thank you. I think so too.
Yeah.
That's why you do case management.
Exactly.
Deal, right.
Exactly.
That's what you do. That's what I want to be, the best of what we do.
Exactly. Exactly. Well, Linda, it's been a pleasure. I wish you and your team and your company great success. I look forward in the future to working with you.
Well, you as well, and thank you for having me today. I appreciate it.
My pleasure. My pleasure. Keep motivating that team, keeping that refrigerator full.
You know I will. All right. Thank you.
Thank you very much. You have a great day.
You too.
Bye.